Welcome, everyone, to today's event. We're going to get started. Today's event is titled Summer Camp, What Children with EB Can Expect. This web presentation is brought to you by National Rehab and EB Nurse. We have heard from many people in the EB community who have asked if summer camp is the right choice for their children. How can I tell if my child is ready to spend a week away from home? How should I prepare my child for the fun and the challenges of camp? What should I pack in their suitcase? We at National Rehab have decided to help answer these questions by hosting this event. Guest speaker, Dr. Samantha Hill, Assistant Professor of Dermatology at the Medical College of Wisconsin and Children's Hospital of Wisconsin, will talk for about 20 minutes today about how parents and children can prepare for the summer camp adventures that await them. Dr. Hill has served as a medical staff volunteer at Camp Discovery in Cross Lake, Minnesota for 9 years. Camp Discovery is sponsored by the American Academy of Dermatology and will host 6 camps this summer. The camps are for people ages 9 to 16 who have chronic skin conditions, including EB. Dr. Hill will attend Camp Discovery this summer for her 10th season. She recently volunteered at Camp Spirit, a winter adventure camp in Colorado for children who have recessive dystrophic EB. After Dr. Hill's presentation, we will open up the forum for questions. We hope this format will allow you to get answers from an expert so that you can make an informed decision about attending camp in the future. Without further ado, please welcome Dr. Samantha Hill.
Thank you, and thanks for having me. As Christine said, we're going to have a presentation entitled Summer Camp, What Children with EB Can Expect. I am an assistant professor of dermatology and pediatric dermatology in Milwaukee, Wisconsin, at the Medical College of Wisconsin and Children's Hospital. I did residencies and training in both pediatrics and dermatology, and I'm board certified in dermatology as well as pediatric dermatology. My important experience for this talk, though, I think is in the camps that I've attended. This will be my 10th summer attending Camp Discovery in Minnesota. I've always attended teen camp. I've been as both a counselor and in the most recent years as medical staff. I've also attended Camp Spirit in Winter Park, Colorado, which is a winter adventure camp. I was there recently for the first time in February, and certainly intend to make that part of my year. So I thought we would start the talk today by discussing tips for choosing a camp, how to know which camp may be the right one for your child and your family. Location is one of the first things to consider. There are camps located in many parts of the country, so you may prefer to have a camp that's located close to your home and reachable by car. For all of the American Academy of Dermatology sponsored camps, plane flight is funded as part of the camp funding, and many of those are located in areas of the country that, depending on where you are, may require a plane trip. Some families and some parents of children who have EB plan to bring a nurse or another medical professional from the clinic that their child attends to come as a volunteer medical staff during the week. This works out really very well both during the week so that your child has someone that they know to help with dressing changes, but also to have someone that they know travel with them. Duration of camp can vary by a few days, but usually is between 5 and 7 days, depending on the camp and the location. Time of year doesn't vary very much. Most of the camps that we're talking about are summer camps. But if you have other summer plans, vacations, work schedules, things like that, you may need to choose a camp that fits into those other schedules. The camps start anywhere from the end of June and run as late as the middle to the end of August. So in general, you should be able to find one that fits those needs. If summertime is too busy or doesn't work out at all, then you could consider a camp that is not in the summertime, such as Camp Spirit, which is a winter adventure camp. some families feel very strongly that they would prefer to have a parent attend camp with their child. Camp Wonder in California, to my knowledge, allows parents to attend camp. The American Academy of Dermatology camps and Camp Spirit, however, don't allow parent attendance, which is difficult for some families, but really can be very important in helping to foster and to facilitate a feeling of independence in the children. Some of the camps are specific to kids who have EB, such as Camp Spirit, whereas most of the other camps include children who have a variety of different chronic skin disorders. And there are merits to both, and families, you may find that one of those is more important to you than the other. And then lastly, some of the camps have a larger group of campers and staff. At many of the Camp Discovery sessions, there are around 60 campers and around as many volunteers, whereas at Camp Spirit, there are usually fewer than 10 campers and about as many staff. So it can vary quite widely. I've included a list of summer camps, most of which, as you see, are through the American Academy of Dermatology. There are camps located in Minnesota, Washington State, Texas, Pennsylvania, and Connecticut. The dates range from the end of June through the middle to end of August, and the age ranges of each camp also vary. Some camps, such as Camp Big Trout, have a very specific age range. That's the camp that was previously known as Teen Camp. And some of the others have age range that goes as low as 8 years of age. Camp Wonder in California, as I mentioned before, is through the Children's Skin Disease Foundation. Their age range is quite broad, from age 7 to 16, and the camp is held at the end of June. That is a camp where parent attendance is allowed, to my knowledge, which for a camper who's age 7 might be reasonable. I've mentioned several times Camp Spirit, which is an EB winter adventure camp held in Winter Park, Colorado. It's been held for 4 years, and the next upcoming dates will be in early 2012, end of February of 2012. It's for children and campers only who have recessive dystrophic EB, and as I mentioned as well, is a smaller, more intimate group. It's held through the Children's Hospital of Denver, Colorado, where they have a regional EB center, and so there are a lot of patients who are regional, but also patients who fly in from both coasts. So after you've chosen the camp, what might you expect? The facilities certainly vary between camp locations. My experience has been with the camp facility in Minnesota and the camp facility for Camp Spirit. Most of the buildings and many of the locations will have buildings that are air conditioned, and that includes, in a lot of cases, the sleeping quarters. The bunks and the sleeping quarters can vary. Some rooms and some locations will have beds with true mattresses, and some will have more of a camp bunk, which might be an issue for campers who have more difficulty sleeping. All of the camps have appropriate medical facilities, and they certainly have qualified medical staff who are part of the camp team. That always includes medical doctors, and generally includes nurses, sometimes physician assistants, sometimes medical assistants. A lot of times there's quite a wide variety of people who come to volunteer to help. Most of the staff is familiar in some way with skin and dermatologic disease, but not all of the staff are specifically familiar with epidermolysis bullosa or specifically have a lot of experience with epidermolysis bullosa. So as I said, it is sometimes a good idea for campers, if it works out, to bring a medical staff that they're familiar with who certainly has a broad knowledge of EB. There are a lot of activities at camps, which is kind of the point of going to camp. And it's important to remember and to plan that the camp or that your child will be more active than they usually are. There are always rest options available. At many of the camps, there are rest hours or rest periods that are built into the day to try to help kids who are very excited to be at camp from not overexerting themselves. But certainly, if a camper or if your child is feeling that they're tired, if they are feeling that they've kind of pushed it a little bit too far, there are certainly options to sit out, to stay in a cooler place, even to take a nap if that is what's necessary. At many of the camps, there's a really great diversity among the campers, and this is with regard to their skin disorder, but also to their social situations, to their hometowns. We have campers come from every corner of the U.S. We often have campers from Canada, and sometimes we also have campers who come from abroad. We've had children come from Australia, New Zealand, Portugal, Belgium, so they really do come from far away sometimes. Most importantly, which is why it's in red, you should expect camp to be a very positive, life-changing experience. I've not met a kid at camp who isn't much different at the end of the week than they are at the beginning, especially if it's their first week of camp. It just absolutely changes their lives. It's really important to have a good plan for what you're going to bring or what you're going to pack for camp. I suppose right off the bat, it's important to pack all the items that are on the routine packing list for campers. The American Academy of Dermatology provides a packing list or a suggested packing list, including things like bug spray, sunscreen, that kind of thing. So it's important to bring that. But in a little bit more specific way for kids with EB, you should really make sure that you send all of the supplies that you might use for dressing changes at home. You shouldn't assume that the camp is going to have any single piece of equipment. They very well might, if it's forgotten or if it's broken or lost or doesn't make it there for some reason. But as best you can, pack everything that you think that they might need for dressing changes. That can include bandages, scissors, needles, any ointments, both non-prescription and prescription. It was suggested that you can consider splitting up the supplies for individual days or individual dressing changes, putting everything that you might need for a particular dressing change into a large Ziploc bag and then pack them that way so that they're already organized into dressing changes. You can also consider shipping supplies ahead of time. Sometimes the volume or the amount of dressings that it takes for a week away from home is a lot. And so you can consider shipping that ahead of time early enough that you know that it arrives and is there before your child leaves for camp. You may consider sending multiple outfits per day for your child, depending on when dressing changes happen, and also depending on what activities your child is participating in. They may get dirty, they may get messy in having a great time, or they may have a dressing change that's a little bit later in the day than they ordinarily would, and they may use an extra outfit during that day. Crocs or other water shoes can be very helpful for protecting the camper's feet. Often when they're in the water, it feels much more comfortable and is much more stable if they have a shoe or a shoe type of foot protection on. And some campers in the past have worn their sneakers into the water which works at that moment, but then they have wet sneakers for the rest of the time, which certainly isn't a good idea.